is the first full day of spring and short sleeve season is fast approaching. Many people are not happy with the appearance of their upper arms, but the good news is there is something you can do about it. Plastic surgeon Dr. Christopher Hamwi is here from Florida Plastic Surgery and Med Spa to tell us more. Great to see you, Dr. Hamwi.
Good to see you as well.
I feel like this is an all too common complaint, all ages.
Right.
What is it, like biology and by the way we're built, that our upper arms become a problem spot?
You know, that's a really interesting question. I don't think we've figured that out, but you've hit onto something, which is that arms oftentimes don't play by the same rules as the rest of our body, right?
Right.
Yeah.
Well,
When
you lose weight, it's great to be slimmed down, but yet it almost creates an issue there.
Yeah, years ago you couldn't do anything about that. Now you can.
Well, yeah, I mean, I'll tell you, I think that what we're seeing is that as people age, the skin becomes looser, the tissue becomes looser, and it tends to sort of hang, and you get this sort of loose hanging area in the arms, and it can really drive people nuts. And you were mentioning, you know, short sleeve season. We're in Florida. It's always kind of short sleeve season.
Right. It's really hard to keep that covered all the time here. So tell us a little bit about how your technique for an arm lift is different.
So arm lifts traditionally have focused on that sort of obvious part of the arm down here. And what we're doing is we're incorporating a more complete liposuction to help shrink the arm and bring out some definition so that we get a really a more complete overall outcome.
Oh, that sounds good.
So it's a combination. It's some liposuction and then also a kind of a tuck?
That's right. So it's a combination. So we can have, you know, if we did a traditional brachioplasty or arm lift on this patient, we would be able to get some of that stuff. And actually that patient had had a brachioplasty before and then came back, and you can see her old scar didn't come out so well. But we were able to really shrink the arm and get like a more complete sort of athletic look, because we're sculpting the arm as well as doing the lift.
Well, and a lot of us have some muscles down under there somewhere. They're just covered.
Haven't shown for years.
Yeah.
Okay, is it painful?
Well, no, and in fact, we do this in a little bit of a different way, and I think that's part of the secret to being able to do this the way that we do it, is we don't use general anesthetic. So we numb up the arm directly, and then we do this procedure, but the patient's awake, and so one, they're very comfortable. They walk on out like nothing happened. They don't have to spend this time in their recovery room. Here's a video right here of a patient in the middle. We've done the liposuction. We've sort of shrunk the arm down on that one side, but you can see the difference between the two sides.
Goodness. Wow, and she just sat there like this while you did that.
Absolutely.
That's amazing.
The arm is numb. It's very comfortable, and then when we're done, we've shrunk the arm, we've made it smaller, they get to go. But you'll notice that because she's awake, I can tailor things, I can be really precise about how I do that. And so I know before the patient's done, before we wrap them up and let them go home, that everything is exactly the way I want it.
And you do a fair amount of re-sculpt surgeries under this local anesthetic. How did you decide that that was going to be so beneficial to both the patient and then your ability to sculpt?
Right. I mean, it really just sort of developed with time, but I found that I was able to be, you know, as precise as I possibly could by doing it that way. And so I was getting better outcomes that way. And, you know, when you're doing something and it's coming out the way you want it, it just, you sort of build off of that.
And it's safer, right? It's safer.
Well,
I would feel better if I can watch what you're doing.
Well, it's nice not to be under a general. I mean, that in general makes you feel worse. So
yeah, you've got to recover from that.
Absolutely.
That's right.
How long is the downtime?
So the body heals, and that takes a period of weeks, but it doesn't particularly hurt. It hurts for a couple days or
so you're out and about.
Oh, you're definitely out. Like, this isn't the sort of thing that will incapacitate you.
Oh, that's wonderful.
Just probably lay off of lifting things and the typical.
I tell people to avoid the gym for a little bit.
Right, absolutely.
Oh, that's a good.
Who is a candidate for this? Are there people that are better candidates than others?
Yeah, you know, we see a wide variety of patients that range from their 40s to their 70s. These are people who have noticed that they've got sort of loose and hanging tissue in their arms that doesn't respond to weight loss or exercise, traditional methods of, you know, shrinking things down. And liposuction, which is typically used for things that are starting to, you know, need a little help, actually deflate the tissue and make it looser. So at some point, that skin, as it gets looser, just isn't going to come in. And so this is essentially a lift, or an arm lift.
And this is also a good solution maybe post-weight loss when you end up with that hanging skin that you didn't know you were going to get.
As you lose weight, you just need it more.
And so that actually has been a big part of our practice, is helping people who are seeing significant weight loss and this is one of the sequelae of that.
All right, well, short sleeves.
Such good news.
Short sleeve season is just a fact of life here on the Suncoast. So if you have concerns about your body, there are many, many things you can do. Site to learn more is floridaplasticsurgery.com.